Respiratory. Hi, my name is Amy, and I'm a respiratory care student, and I'm here today to help you, give you a little breathing exercise to help you cough up any secretions that you may have. So today I have here what's called an acapella, and this here is a device that will be used to kind of give you a little fluttering, and it's going to help you cough up those secretions. So before I help you here, I'm going to wash my hands and dry my hands, and then I'm always going to check your ID band here. All right, we're going to just look at your vital signs here. I'm going to listen to your heart and the lungs just to make sure everything sounds good. So after I got done with that, listening to everything, the lung sounds, and then I'll proceed. So here, okay, so like I was saying, we have an acapella here. This little blue machine here. This is a little handheld thing that you can take home with you when you're done with your visit here, okay? So this, I always want to set it at the lowest setting. So as you can see, there's a minus sign, so you want to have it at the lowest setting to start them off with. Because especially with elderly patients, they might not be able to get that breath in and breath out to make it flutter like it's supposed to. All right, so with this, we don't want to cover the end with your hand. You want to leave it open because that needs to get that air out, and that's what makes the fluttering sounds and you're feeling in your lungs, okay? So we're going to have you hold it kind of like a microphone here. And with the mouthpiece, I'm going to have you put a tight seal around it, and you want to have your tongue underneath it, okay? That way it doesn't obstruct the mouthpiece, and that way you get the appropriate treatment that you need. So these can be used every time after you've had like a nebulizer treatment or anything like that, so you can do this. So today we're going to do it at least 4 to 8 times for 10 to 20 minutes. So I'm going to do a few times, and then we're going to take a break, and we're going to do just normal breathing for a little bit, and then we'll go on again to do a few more, okay? So what I'm going to have you do is, what you need to do is take a deep breath in and exhale. But when you exhale, I don't want you to have like a quick breathing out. I want you to do a nice strong breath but out, but I don't want you to do it forcefully, okay? So you're going to take a deep breath in and then exhale like that, okay? So I'll have you put it up to your mouth and we'll do it together. All right, so take a deep breath in and exhale. Good job. All right, so we'll do that a few times, and then I'll give you a break. And you don't want to do it super fast out because it can make you feel like you're ready to pass out, and we don't want that happening, okay? Now, when you go home with this device, I would like you to do it at least once an hour. Just that way it gives you practice on how to use this, and it also helps you practice coughing up those secretions, okay? So once I'm done with this device, I need to put it into a safe bag, and then I can also wash the mouthpiece with sterile water and clean that up for them for when they go home. So we can set this off to the side, and when I'm done with giving the treatment, I always need to wash my hands again, dry them, and then reassess the patient. I need to get their vital signs, check their blood pressure, temperature, anything like that, and listen to their lungs to see how they're sounding after the treatment. And then if they have any sputum that may come out, I need to chart down what the color was, how thick it was, if it has any foul odor to it or anything like that. And then I chart it on the charts, and then let anybody know, like that's been helping, like the nurse that's been helping the patient. That way they know that they've had a treatment and they've had a practice with their acapella.